I'm Dr. Oscar Serrano from the Hartford Hospital Comprehensive Liver and Transplant Program. Today I want to talk to you about a project that we recently completed titled Appraisal of the Impact of the Race-Neutral Estimated Glomerular Filtration Rate Waiting Time Modifications on Transplant Wait Time and Outcomes for Black Kidney Candidates. Importance of Transplant Readiness on the Waitlist. We know that systemic inequity in kidney transplantation persists as a pressing issue in the transplant community, particularly affecting Black individuals in the United States. The current U.S. kidney transplant waitlist policy requires all adult patients, regardless of race, to have an eGFR less than 20 to be eligible to begin accruing wait time on the waitlist. Historically, race-inclusive kidney function estimates incorporated a Black race coefficient which overestimated the median GFR in Black individuals. This overestimation had significant implications, potentially delaying transplant referrals, waitlisting, and the accrual of time on the waitlist. In July of 2022, the U.S. Organ Procurement and Transplantation Network announced that transplant programs are prohibited from using GFR calculations that include a race-based variable. This policy requires that transplant hospitals identify Black kidney candidates whose qualifying date was based on a race-inclusive GFR calculation and assess if a race-neutral calculation would have made them eligible for an earlier adjustment. This study investigated the impact of applying GFR wait time modifications to a cohort of Black patients previously listed at our center between 2000 and 2023. Overall, we identified 126 patients on the wait list at our center. Of them, 76 patients, or 60%, qualified for wait time modifications. The implementation of the race-neutral GFR calculation resulted in a median wait time gain of 570 days, or 1.6 years, and a total cumulative gain of over 62,000 days, or over 180 years for the entire cohort. Between January and July of 2023, 26 individuals, or 34% of the cohort, received a wait time gain, had a kidney transplant, within 6 months of receiving the adjustments. When compared to other groups, the wait time gain patients had a significantly higher BMI, higher rate of diabetes and peripheral vascular disease, and after a median follow-up period of about 8 months, the 3-month readmission rates were 50% for those patients that had wait time gain versus 17% for the other two cohorts. Our report emphasized a substantial benefit for Black patients through potential gains in days by modifying the GFR equation and avoiding the initiation of dialysis. That said, our findings highlight the critical importance of transplant readiness in this vulnerable population, suggesting that more frequent visits to the transplant clinic rather than standard annual visits and personalized interventions may be necessary. Thank you.